Hello and welcome. Today we're diving into a rare and complex neurological disorder known as childhood disintegrative disorder, often abbreviated as CDD. This condition, sometimes referred to as Heller's syndrome or disintegrative psychosis, is characterized by a dramatic loss of previously acquired skills in areas like language, social function, and motor skills, typically occurring after a period of seemingly normal development. Unfortunately, the exact cause of childhood disintegrative disorder remains largely unknown. Unlike some other neurodevelopmental disorders, there's no single gene or environmental factor that has been definitively linked to CDD. Research suggests that it is very rare and the causes remain a mystery. Possible theories include underlying neurological conditions, autoimmune disorders, or metabolic issues, but none have been conclusively proven to be the primary driver of the disorder. It is not considered to be caused by environmental, socioeconomic, or psychological trauma. The pathophysiology of CDD is complex and not fully understood. It's believed to involve progressive deterioration within the brain, particularly in areas responsible for communication, social interaction, and motor control. Studies have shown possible abnormalities in brain structure and function, including reduced cerebral blood flow and metabolic activity, and differences in white matter integrity. These alterations likely contribute to the loss of skills that defines the disorder. Further research using neuroimaging techniques and post-mortem brain studies is needed to gain a more complete understanding of the underlying biological mechanisms. Childhood disintegrative disorder is exceptionally rare. Estimates suggest it affects only about 1.7 per 100,000 individuals, making it significantly less common than autism spectrum disorder. It affects males more often than females. The onset of the regressive phase typically occurs between the ages of 3 and 10, after a period of at least 2 years of normal development. Because of its rarity, accurate epidemiological data is challenging to collect. The most striking characteristic of CDD is the marked regression in skills that the child had previously mastered. This can manifest in several ways. For instance, a child who was once verbally fluent may gradually lose their ability to speak or understand language. Social skills decline, with a loss of interest in playing with peers and difficulty understanding social cues. Motor skills deteriorate, impacting coordination and fine motor abilities. Bowel and bladder control may also be lost, despite previous achievement of continence. These losses occur over a period of months and can be quite distressing for families to witness. Diagnosing childhood disintegrative disorder requires a comprehensive evaluation by a team of specialists, including neurologists, psychologists, and developmental pediatricians. The diagnostic criteria, outlined in the DSM-5, include a period of at least 2 years of normal development, followed by a significant loss of previously acquired skills in at least 2 of the following areas: language, social skills, bowel or bladder control, play, or motor skills. It's also important to rule out other conditions that could mimic CDD, such as Landau-Kleffner syndrome, metabolic disorders, and other neurological conditions. Thorough medical history, physical and neurological examinations, cognitive and behavioral assessments, and sometimes brain imaging studies are employed to arrive at a diagnosis. Childhood disintegrative disorder does not have formally recognized subtypes or classifications, unlike some other neurodevelopmental conditions. The core feature is always the significant regression in previously acquired skills after a period of normal development. While the specific skills lost and the severity of the regression can vary from individual to individual, there are not distinct categories within the disorder itself. Currently, there's no cure for childhood disintegrative disorder, and treatment focuses on managing the symptoms and providing support to the child and their family. A multidisciplinary approach is typically employed, including behavioral therapy, speech therapy, occupational therapy, and physical therapy. Medications, such as antipsychotics or stimulants, may be used to manage specific symptoms like aggression, anxiety, or hyperactivity. Early intervention and ongoing support are crucial to maximizing the child's potential and improving their quality of life. Parent training and support groups can also provide invaluable resources and assistance to families navigating the challenges of CDD. Given that the cause of childhood disintegrative disorder is unknown, there are currently no known preventive measures. Because it is so rare and its etiology is largely a mystery, the focus remains on early detection and intervention to mitigate the impact of the disorder on the child's development and well-being. The prognosis for individuals with childhood disintegrative disorder is generally guarded. The degree of recovery varies, but most children experience significant and long-lasting impairments in their cognitive, social, and adaptive functioning. Many individuals require ongoing support throughout their lives, Recent research efforts are focused on identifying potential biomarkers for early diagnosis and developing targeted therapies to slow down or reverse the degenerative process. These studies include genetic analysis, neuroimaging studies, and investigations into the role of immune system dysfunction. While breakthroughs are still needed, these ongoing research efforts offer hope for improved outcomes in the future.